All right, what's going on, everyone? Brad here with Top Tier Physical Therapy, back with another YouTube video. In this one, we're going to be talking about shifting with certain movements. Think something like squatting, deadlifting, bench pressing, or overhead pressing. It's going to be something great for other physical therapists, personal trainers, coaches, or even yourself if you feel like you are shifting during some of these movements or you have some kind of movement compensation. This may give you some ideas of where to look to tease out why this is happening and then address that issue so we can hopefully address that shift or that movement compensation. So number one reason, or the first reason I should say, why someone may be shifting is because they have pain in an involved joint. So if we think about a squat, if I have pain in my knee, I am likely going to shift off of that knee as I go into a squat. So if bending my knee is painful, as that knee bends in a squat, I may reach a point where I don't want it to bend anymore, but I'm not finished going through my full squat motion yet, or what my body thinks is the full squat motion. So I go into this shifting pattern. So if my right knee is bothering me here, and once I get to a certain point, I can't really bend it anymore, then you might see me shift to the left to try and get lower in that squat, but I'm doing so primarily by loading my left side versus letting my right knee bend. So if someone's moving around pain, this may be a reason why they are shifting. Reason number two why someone may be shifting is a lack of strength. So back to that squatting example, if I have weakness in this right knee, I may be utilizing my left leg more to complete a squat, and that would result in me seeing a shift. This is something where, if it's appropriate, it may be a good idea to, if we are a coach or a trainer, we load our client up with some weight to really reveal any weaknesses, because if a body weight squat is not quite challenging enough for that knee, they may be able to do a symmetrical squat. But as I load the barbell up, it may be more revealing of the lack of strength in an involved leg. This could be something you do individually, where if you can see yourself in a mirror, slowly start to add weight and see if, as things get heavier, you start to shift. That may lead you to believe that if I don't have pain, maybe my whatever side I'm shifting, it might be weaker. So I have seen it in both scenarios where I shift towards my weaker side and I actually shift off my weaker side. So in that squatting example, let's say my right knee is weaker than my left. I have seen it where people go into a squat and they shift towards their stronger side just because they're favoring that side. That's one we commonly see in post-op patients where they're not quite trustworthy of that knee yet because it's weak. So they want to lean towards their more stronger, more comfortable side. I've also seen it where coming out of a squat or coming out of a lift, where we're going through that concentric portion of a movement. So a deadlift, it would be when I'm pulling up. Squat would be when I'm standing up. Bench press would be when I'm pressing the bar up, where we actually see a shift towards the weaker side because the stronger side is pushing the body that way. So again, with a squat, if my right knee is weak, as I'm coming out of the bottom of that squat, I may be able to push so hard with my right leg that I actually push myself to the right. So let me go through that again. If my right leg is weaker, I'm coming out of that squat, I'm pushing so hard with my left leg that it pushes me to the right. So a strength deficit in a limb may lead to some kind of shift, and it may not always be clear whether I'm shifting towards or away from that involved side. All right, reason number three why I may be having some kind of shift or movement compensation is lack of the necessary mobility to complete that movement. So again, if we're sticking with a squat, if my right knee will not bend as far as I need it to get through a full squat, get into a full squat depth, I may see myself shifting towards my left leg. The body is going to follow the path of least resistance. So if it's trying to move symmetrical, but the right side is stopping, it's going to try and continue that movement, but shift towards the left because the left knee will bend. So if I have a restriction in my knee where it won't bend more than, let's say, 90 degrees or so, I may see myself shift to the left and the angle of my right knee doesn't change much. So from a different angle, that would look something like this. Can't get lower. There's a certain point where it'll bend, then it stops bending, and that's kind of when I see the shift. Again, this is pretty common in someone that's coming off of surgery, knee surgery, whether it's a knee replacement or some kind of ligament repair. But we could also see this with overhead pressing, where if I have someone who, when they try and raise their arm overhead, they only get about this high on one arm, but the other arm can come all the way up towards their bicep to the ear. When that person goes to press overhead, they might shift that bar towards that restricted side because it's not able to center and stretch or press straight overhead. So I can't get my right bicep to my ear, so that bar is going to travel where my right shoulder will allow it to. All right. With bench pressing, it could be the same thing where maybe my right shoulder doesn't get into as much extension or horizontal abduction. So when I lower that bar down to my chest, my right arm will eventually stop moving, and then I come down to the left, and then that may change what my press looks like as well. So now not only is my lowering of the bar or the eccentric portion of that lift shifted, but now that may lead to the concentric portion of my lift being shifted. So not having the necessary motion to complete that movement in a symmetrical pattern is another reason why you may have some kind of shift. And the final reason why someone may be shifting with a movement or having some kind of movement compensation is they simply don't know they're doing it. In my experience, what this often is preceded by is some kind of pain, weakness, or mobility deficit that contributed to them shifting in the first place. So prior to them resolving that issue, let's say they were doing a squat and they had a pain in their knee. Every time they squat, they would shift off of that knee. You address that knee pain, they don't have any strength deficits, they don't have any weakness, they don't have any mobility deficits, I should say. And when you have them squat, they still have that shift. The reason for this is because that is how they are now programmed or wired to perform that movement. So when we talk about motor programs, we're talking about planned movement patterns from our brain that is a subconscious telling of our body what to do. So if you think of walking, if I was to tell you to walk across your living room, you're not thinking to yourself, okay, push off with one foot, land on my heel, push off with the other foot. It's subconscious, you don't think about it, and you can just go and do it. What we can establish with squatting and deadlifting and overhead pressing are movement patterns or motor programs, but these motor programs can be altered when we have some kind of pain, weakness, or mobility deficit to allow us to shift. So we have this motor program developed where now we are shifting away from a involved joint. Once that is resolved, that motor program is still there. So now we're continuing to shift despite the underlying issue being resolved. So then what we need to do is retrain our brain to understand this is what it feels like to squat, deadlift, or press symmetrically without a shift. So I think that's something that can be very important for other PTs or personal trainers, or even an individual where, yes, my knee doesn't bother me anymore, but am I still shifting? It feels good when I squat, but does my squat look good? Does it look better than it was when I was shifting off of that knee because of pain? Okay, so there you have it, the 4 reasons why someone may be shifting or having some kind of movement compensation during a functional movement that involves both my arms or both my legs, some kind of pain that they're experiencing in one of those joints that is moving, a strength deficit in one of those joints, a mobility limitation in some of those joints, or a change in their motor program that is subconsciously having them shift without them knowing it. So use this as a screening. If you look at someone shifting, whether you're a coach or personal trainer, you see them move and they are shifting. That's 4 reasons why that could be, and maybe help you dive into that evaluation or that investigation a little bit more to figure out which of those 4 reasons is the main culprit there. So hopefully this video helps you guys out there. If you have any questions, leave me a comment below, and I will see you in the next video.